Good evening. Welcome to the Dole Institute of Politics. I'm Bill Lacey, the director. The Dole Institute is honored to host the inaugural Jana Mackey Distinguished Lecture. Most of you know that the Dole Institute's mission is to engage students and others in public service and to do so in a bipartisan, philosophically balanced way. I never had the opportunity to get to know Jana, but when her friend Liz Stewie, a recent graduate of KU, asked me to lend the Dole Institute's support to this effort, I immediately agreed. After all, Liz was a strong supporter of our activities here. What I have learned since last July was that Jana was a passionate advocate for women. She was fully engaged in serving a cause that she held dear. Her life should serve as an inspiration to all of us who place an emphasis on public service and involvement in our communities and nation. We will have a Q&A opportunity after our speaker tonight. We would ask that you raise your hand, that you wait for one of our students to bring by a cordless microphone so that we can get the question so everyone can hear it and so we can get it on our video. And we ask that you do, in fact, ask a question. We are videotaping. Actually, we're doing it digitally, I think. I said tape, but it's digital. We will have this program available for review on our website in a couple of days. It's my pleasure to introduce the individual who coordinated the many entities involved in tonight's program, the program director of the Emily Taylor Women's Resource Center, Ms. Kathy Rose Mackey. Kathy.
Thank you. Oops. It's an honor to be here this evening and to introduce the inaugural lecture of the Jana Mackey Distinguished Lecture Series. Last September, following Jana's death, there we go. I thought I was going to be all right. Let's try again. A number of us from the KU campus and the Lawrence community gathered together to create an ongoing tribute to Jana, an amazing woman who touched everyone in her path with her passion and commitment to challenging the status quo and making this a safer, freer, and more equitable world for women. Challenging the status quo is a phrase I heard a lot from Dr. Emily Taylor. It was a favorite of hers. Many of you will agree who knew her. And Emily Taylor is the former Dean of Women on our campus and is the namesake for our center. And it was important then when Dr. Taylor was the Dean of Women, and it's equally important now to challenge the status quo. So it's fitting that we continue the charge of these two amazing women who were both forces to be reckoned with. This lecture series was created to generate important dialogue about gender equity and to call us to action. Conversation is a good starting place, but it's essential. We all carry the torch. And in the spirit of service, as the saying goes, we should put our money where our mouth is. We encourage you to thoughtfully consider this evening, inspired by our speaker's words, how can I make a difference? How can I pick up the torch? It is now my pleasure to introduce Jana's parents, Kurt and Christy Brungard. These two people are so inspiring and amazing, and like their daughter, they exemplify courage, tenacity, and hope. They have my deepest admiration. Both are at the Fort Hays State campus. Christy is an instructor for leadership studies, and Kurt is the Voss Distinguished Professor of Leadership Studies and the Director of the Center for Civic Leadership. I now call them forward.
Thank you, Kathy. On behalf of Jana's family, I would like to express our thanks to all of those who have made this evening possible, as well as all of you for understanding the importance of this topic and your willingness to come join with us as we learn more. Jana built her life around two guiding principles. The most important value in Jana's life was her strong belief in equality for all people. The second most important value to Jana was to have the courage to stand up for her beliefs. Throughout Jana's life's work, from community activist, KU Women's Studies student, to volunteering with sexual assault victims, to her work as a lobbyist for now at the Kansas State Capitol, and on to her decision to obtain a legal education from the KU School of Law, Jana chose not to just talk the talk. She truly walked it. Merely knowing about the history of women's successes, yet remaining barriers, was not enough. Jana believed in the power of the doing. She worked hard to become that Gandhi-inspired change she wanted to see. On a daily basis, Jana chose to turn her issues into action. She did the research to understand the history behind the issue, but she was a rare individual who would then turn that knowledge into action and not quit until the change had occurred. Jana had a lot of work yet to do. One day last November, Kurt and I walked into the National Now office in Washington, D.C. We were there to ask Kim Gandy if she would be the inaugural speaker in this lecture series to honor Jana. Kim, a woman who epitomizes all that Jana stood for, looked at us and without hesitation said, "I would be honored." As Jana's mother, I will never forget those words. Having my daughter remembered by one of Jana's greatest role models, a woman who fights daily for equality for all women, is the ultimate compliment. Kurt would now like to explain a little more about our attempt to do what Jana would have done, turn tragedy into action.
I would also like to add my thanks to the University of Kansas and the community partners for this exciting project. On a personal note, I would also like to add a special thanks to Kathy for her leadership in turning a simple idea and concept into this reality. On July 9th, 2008, the speakers at Jana's funeral call on all those in attendance to pick up Jana's fallen torch and carry her work forward. That day, here in Lawrence, Kansas, was about turning tragedy into action. It was simply a call to action. Since that day, family, friends, and even strangers have been working hard around the country to build Jana's legacy. A legacy built around two basic themes: community and women's rights. Jana was first and foremost a devoted civic servant and was committed to community in all its forms. And secondly, Jana was a strong social activist, fighting for women's rights at every single turn. Her legacy that we build is about the total Jana. First, we have created the 1100 Torches national campaign where we use Jana's inspiring life to encourage hundreds of ordinary citizens to simply serve others and to make a difference. And secondly, we continue Jana's important work on promoting women's rights and equality. The Jana Mackey Distinguished Lecture Series is a great example of carrying on her torch. In addition to thanking KU for honoring our daughter in such a powerful way, we would also like to challenge the students and faculty of KU to integrate this lecture series in both curricular and co-curricular activities and everywhere issues of equality are promoted. It is our hope that this series will lead to first, a public understanding, and then secondly, to action that brings about real change. The late John Gardner, in a book called On Leadership, once wrote, "The first step is not action, the first step is understanding." But in the same breath, Mr. Gardner says, understanding alone is never enough. It must be followed with persistent action. Finally, let me say how happy the family is about having Kim Gandy, the president of NOW, as our first speaker. We believe there is a strong symbolic message here. Not only was Jana a strong, committed, and loyal member of NOW, there's something even more powerful here. NOW is the only comprehensive multi-issue women's rights organization in America, where they focus on reproductive rights, economic justice, violence against women, promoting diversity, and a host of other issues. What Jana taught me was that to understand these complex issues, you had to look at the relationship between the issues. In other words, Jana reminds us that these issues are all interconnected and they have a direct relationship to the basic rights of human beings and equality. How fitting that the president of the National Organization for Women, Kim Gandy, be our first speaker. Let me conclude my remarks by saying our goal of Janas Legacy is to mobilize hundreds and then eventually thousands of citizens to ever so slightly change the course of history. Through the various programs, projects, and individual actions motivated by Jana, we hope to produce a world that is more giving, more caring, and simply more just. We hope that this work will produce a society where all people are treated with dignity and respect. And it is our hope that this one fallen torch has ignited a world for social change. Thank you very much.
It is my honor to now introduce our speaker. Kim Gandy is serving her second term as president of the National Organization for Women. She has served as a national officer since 1987 and has been active in state, local, and regional leadership since 1973. She has led NOW's campaigns on a wide range of issues, including Supreme Court nominations, to the rights of mothers and caregivers, from Social Security reform to ending the war in Iraq. During her presidency, NOW has celebrated its 40-year anniversary, organized conferences on issues affecting women of color, women with disabilities, has campaigned against Walmart as a merchant of shame, has expanded efforts to win equal marriage rights and benefits for same-sex couples. Through the creation of NOW's Campus Action Network and the Young Feminist Task Force, Ms. Gandy has demonstrated a commitment to reaching out to young women and encouraging their leadership to the organization. Kim Gandy graduated from Louisiana Tech University with a BS in math. She received her law degree from Loyola University School of Law, where she was a member of the Loyola Law Review and the National Moot Court team. She went on to serve as a senior assistant district attorney in New Orleans, and later opened a private practice. And at that point, she litigated countless cases seeking fair treatment for women. She authored the state's first Domestic Abuse Assistance Act and was a founding director of the Metropolitan Battered Women's Program. I am pleased to introduce to you Ms. Kim Gandy.
I was afraid this was going to be a guy podium. Those of you down front will have to watch me up there. You have to get the camera up to a little angle down for this. I was at a square table in a square room in a very square building on Prytania Street in New Orleans, right up the street from Uglisich's. We called it Uglies. It was where we went for a trout sandwich on payday. It was my very first day on the job at the phone company. I was dressed more like the teenager I was, and a newly minted math major with a brand new job as a statistician, filling out my employee paperwork. My very first day on the job. I was wearing one of those slimy polyester shirts that were popular in the 70s, you know, with the big loud pattern. Fashion could have really skipped that entire decade and been better for it. And when I got down to the bottom of the form, it said, if a married woman, husband must sign here. So I asked my boss about that, my new boss, and he said, oh, that's just the Lord and Master law. Because your husband owns your paycheck, we have to have his permission to take any deductions from it. Oh, I said. And that's why I'm here today. Because truth be told, if it hadn't been for the head and master law, it wasn't called Lord and Master, it was called Head and Master, but it really did exactly the same thing he said. If it hadn't been for that, I never would have found the National Organization for Women. The other reason I'm here, and the real reason, is Jana Mackey. And her mom and stepdad, Kurt and Christy, and truly, I am incredibly honored to be asked to give this first lecture in what I know will be a long and moving and successful lecture series that will change the lives not only of the people who participate in it, but the people that they touch as they go out into the world. It's an amazing and important recognition of the impact that Jana Mackey had on all of us, despite her youth, or perhaps because of it. Christy told me that, and she said it to you earlier, that in March of last year she'd gone to a leadership forum where she was asked to prioritize her top personal values. And she listed number 1 as equality for all. And she listed number 2 as the courage to stand up for her own beliefs. And as Christy put it, Jana walked her values. She lived the equity imperative that is the title of today's evening. And she really was a shining example of women's leadership and what women can accomplish when they really put their minds and their hearts behind it. And I hope that the leadership that Jana brought will be replicated in each of you, in your community, and in the country. What is an equity imperative? What does it mean? I thought about it myself when Kathy said the equity imperative, and I thought, well, okay, it's one of two things. It's either it's a leadership issue. It's an issue of fair representation of women in political office and in the decision-making structures of the country. Is that the equity imperative? Or is it more individual? Are we really talking about fair and equitable treatment for individual women and an end to discrimination and violence against women and the like? Well, it's both of those, and both of them make a difference. Starting with the number 2, the fair and equitable treatment for individual women, we've come a long way since the days of head and master. We actually got rid of that in 1980. Okay, not so long ago after all. But it wasn't too long ago when employers said with impunity, oh, we don't hire women. It was very common at the nicest restaurants in New Orleans. If you were a woman, you didn't apply to wait tables at Antoine's or Galatoire's. They just said, we don't hire women. And even after now sued to force the New York Times to integrate their help wanted ads, because they said help wanted male and help wanted female, and you can guess where the good jobs were. Yet, in my home state of Louisiana, into the 80s, there were local newspapers that had sex-segregated help wanted ads in the newspaper. So it's not been so far in history that we've forgotten it, but at the same time, we've made so many gains that there are people who really think that we've come as far as we need to, and that we genuinely have all the rights that we need. And in fact, there's a group of people, there really is, for every gain we make, there's a backlash. And those folks work pretty hard to convince the rest of us, particularly young people, women especially, that they do have all the rights they need and that they don't need to work for change. And indeed, a lot of people have bought into that. Sometimes we have to remind ourselves that just because a lot of people think it doesn't make it so. And despite what a lot of people think, we have a lot of work to do. Start with something like pay equity. A lot of people believe men and women are paid equally, or at least paid equitably, and believe that whatever gap there is due to women. Well, women must not be working as hard. But the reality is that the gender gap is 78 cents on the dollar for women who are working full-time year-round. That excludes people who are working part-time or seasonal or didn't work the full year. This is full-time year-round employment, and women are bringing home 78 cents on the dollar on average. Now, it's an improvement over the 59 cents that it was when I started on this, but at the rate we're going, in fact, the last few years we've only been improving about a third of a penny a year. It's going to be more than 50 years before we get to pay equity at the current rate. We're talking a couple of generations. A lot of people realize that abortion is under attack, but what they don't realize is that there's a concerted effort to make birth control and family planning less available. In fact, when you tell them, they say, "Oh, come on, you're exaggerating." They really believe that there's no concerted effort to limit access to birth control. But in fact, if you look at the news, you will find that pharmacists who've been filling prescriptions for the pill since 1966 have suddenly been struck with a conscience that says, "I can't fill any more prescriptions for the pill. It's against my conscience. Never mind, I've been doing it for 40 years. And lawmakers are letting them get away with it. The American Life League, how many of you have heard of the American Life League? They're fairly strong in the Midwest. Their literature says, and I quote, "Any action, including condom use, which has as its purpose to render procreation impossible, is intrinsically evil." And they have a campaign now called The Pill Kills, the purpose of which is to convince women that the pill is dangerous and that they shouldn't take birth control pills. Now, I would say that this means we've got work to do when we have members of Congress that, contrary to the wishes and will of their constituents who overwhelmingly support access to birth control and contraception, when we've got to educate them that the birth control pill is not the same thing as abortion, we've got a lot of work to do. My 16-year-old daughter would say, "Duh." Now, those same lot of people still think of HIV and AIDS as a gay disease. Yeah, really, even today, a lot of people think that. But we know now that women are the fastest growing population with HIV, and most all contracted it through heterosexual contact. Yet, the investment that we make as a country in education and prevention is really paltry. It's very, very small. And so we have a lot of work to do. And I hope that part of it will be winning universal, single-payer health care for everyone in the country. All right, this is impressive. They're planning for me to speak a long time. Would you look at this? There are 3. He told me there were 3 bottles of water under there. I didn't believe him. There really are 3 bottles of water under there. And on our way to that single-payer universal health care that we want and need, we need to make sure that women's health care needs aren't shortchanged. And I've had this conversation with some pretty progressive people who work on universal health care. And I say, you know, as you're writing that, be sure to say that universal means that your default patient isn't male, because that's the way the system works now. The default patient is male. Pretty much everything men needs is covered by your basic health care plan. But if you're a woman and you go out to buy health care for yourself, if you think you might possibly get pregnant and need prenatal or maternity care, you got to pay extra for that. If you think you might possibly ever want an abortion, you got to pay extra for that. And chances are good that although Viagra is guaranteed to be covered, your birth control pills probably aren't, because male is the default patient in the way that our health insurance operates. And if we replicate that into the universal coverage of health care, then we're going to have universal coverage for men and partial coverage for women. And it's a very simple argument. It's pretty straightforward. If you're going to cover men's needs, you should cover women's needs as well. But even a lot of progressive people that I talk to say, well, that's included. That's included. I say, well, could we spell it out that it's included? It actually hasn't been spelled out yet. So those of you who are working on health care reform and are active in organizations that work on health care reform, something to think about, because in my humble experience, if it's not spelled out, it's probably not going to be there when push comes to shove. In fact, we can just make that our slogan. You know, if you're going to cover his Viagra, you've got to cover my birth control, and we just make that our battle cry. On a somewhat related issue to this, a lot of people think that teaching abstinence only in the schools is a good idea. And as the mother of 8th and 10th grade daughters, I think abstinence is a very, very fine idea. The problem is that when some people say abstinence only, they really mean let's lie to the kids. Back in my home state, the curriculum of the governor's program on abstinence says that, quote, there is no clinical proof showing condom effectiveness, close quote. This is what's required to be taught. Now, they think, let's tell them that condoms don't work and then they won't have sex. Wrong. The idea they get from condoms don't work is when we have sex, there's no point in bothering to use a condom because they don't work. And, well, you know where that leads. Just ask Sarah Palin. Who apparently still advocates for abstinence-only education. The reality is that, that our kids need to be given age-appropriate, medically accurate information, and you can't assume they're going to get it at home. Most of us are going to tell our kids at home, but not everybody's getting the message, and it's important that we begin to move our country to a place where medicine and science govern the decisions that we make. All right? Another issue that there is a lot of work to be done on is the issue of job segregation. We have, if you look, it's pretty easy to see if you look around, enormous job segregation by gender. Yet, even in fields that are heavily female, the smaller number of men in those heavily female fields tend to earn more than the women in those fields. Male nurses tend to earn more than female nurses, for example. And in fact, a woman dentist who was very active in the Dental Association told me a while back that she got a lot of grief from some of the men who said that the women dentists were causing problems for the men because they were spending too much time with the patients and it was making them look bad. Now, I don't think for a minute that that man's comments reflected the opinion of male dentists generally, but it is an example of the sense that when women enter a male-dominated field, the incomes are likely to go down. And that is one of the reasons that job segregation needs to go, but the other reason is a very simple and straightforward one, which is that women are channeled into jobs that pay less. Or, depending on who you listen to, some people think that those jobs pay less because they're dominated by women. Secretaries used to be a very, very high-paying field. My old friend, the late Larry Lader, was started out as a secretary. He was who's heard of Margaret Sanger? She is okay. He was Margaret Sanger's secretary because only men could type. They felt that it was far too strenuous for women. I'm serious. And so the only people who typed were men. And so back in the 20s and 30s, he was the assistant and the secretary to Margaret Sanger, and he ended up being one of the founders of NARAL. And just passed away a few years ago. Wonderful, wonderful man. But that's a field that was very high paying when it was dominated by men, and once women started moving into the field, guess what? The salaries went down. And the only way really to deal with that is to have a uniform system of evaluating and analyzing jobs for pay equity and determining the value of those jobs from an objective criterion, because frankly the market forces don't work. And I'm not going to focus too much on any one item. I just want to sort of go over a variety of issues that are facing us that a lot of people don't think are an issue, but really are far more than you think. For example, in terms of jobs, women are getting more than 50% of all the math degrees, yet they're only 8% of math professors. Women have been nearly 50% of law firm associates for 25 years. We've been the majority of law school graduates for 30 years. And yet, when it comes to partnerships, they're partying like it's 1954. Women are only 16% of equity partners in law schools, after 25 years of being 50% of the associates. 16 almost seems to be a magic number. We're 16% of fire departments, we're 16% of police departments, we're 16% of the U.S. military, and until the last election, we were 16% of Congress. We've eased up to 17% in the last election. Whoa! We're getting there. It almost feels like it's a magic number, like there's a cap. When women get to a certain percentage in a field, then it's the men start getting nervous. I don't really know what the explanation is. I'm waiting for someone in sociology or human behavior or something to look at this number 16. I mean, think about it. 16% of law firm partners. We were 16% of Congress for a while. Both houses, the same 16%. 16% of governors. We're about to drop to 14 when Governor Sebelius is sworn in. But right now we're 16% of governors. Think about that. It's almost like a ceiling for women to be at something under 20%. In leadership, and that really is something that we as a society have to address. There's no one person or one organization or one movement that really can address that, but it does have an impact on society when women are so limited. And finally, it goes without saying that violence against women is epidemic, as we still mourn our beloved Jana, both in our homes and on the streets. And in this case, that lot of people actually do recognize that violence against women is a serious issue. They get it, that rape and domestic violence are a problem. But that didn't stop Walmart from selling a T-shirt that said, "Some call it stalking, I call it love." Or a brand new movie just out depicting the star of the movie raping his date, who is passed out from booze and pills and has just vomited everywhere before she passed out, and he rapes her. Current movie, Observe and Report, with Seth Rogen. And the date was Anna Faris. And when she was interviewed, just about her life in general, it was sort of a general interview, she didn't name the movie, but she said, you know, I did a scene recently in a movie that I was sure could not possibly stay in. I said, there's no way they would let this scene stay in. And the implication was she hadn't wanted to do the scene, but she was comforted by the idea that it would never make the final cut. And it did. It's in the movie. And it's played for a laugh. So just when you think that there is an issue, violence against women, that people are starting to understand and are starting to take seriously, you have major film studios and major department stores making light of violence. So we still have a lot to do, and in situations like that, it really is individual reaction that affects what people do. Whether you shop at the store that sells that t-shirt, whether you go to the movie that glorifies rape or says it's funny, that's an area where your individual action really can make a difference. And you know, these issues are just the tip of the iceberg. I mean, it really, there are so many examples of ways in which we've made progress, and then we've got still a real leap to go before we really get to equity for women, especially women, but also for girls. Now, that was the first part of the equity imperative. That was the issues that affect individual women, discrimination and violence and the like, and clearly there's an imperative for action there. But what about the second part? What about women in leadership? What does that mean? Is it important? Does it make a difference? I mean, the news isn't very good. We just talked about the U.S. Congress. Women are 52% of the population, but we are 17% of the 100 senators, and we are 16.8% of the 435 representatives in the House, up from 16 last 2 years ago. Boy, if we go up 1% every 2 years, how long will it take us to get to 50%? 70 years, thereabouts. It's a long time. And you know, people say, and they really are genuine in asking this, they say, well, does it really make a difference? I mean, as long as you have people who support women's rights, is it important? And the reality is that women, even though they have been a very small minority of Congress for many years, it's only been in the last 20 years that we've gone beyond 2% of the Senate. In fact, it was 1992 that we finally leaped beyond being 2% of the United States Senate. It was the year Dianne Feinstein was elected, and her slogan was, 2% is only good for milk. And she and Barbara Boxer were both running for the Senate from California, and what a fight that was, because all of the powers that be said you can't both run. They'll never elect two women. And one of you has to get out. And back and forth they went, and back and forth they went, and finally Dianne and Barbara got together and said, you know what? We can both win. And then they did the completely unthinkable. They campaigned together, which they were told, don't ever be seen together. You can't remind people that they might have two women in the Senate, because, you know, if you're together, that'll remind them. Anyway, sometimes you just have to break the rules. But we did finally get past 2%. They were both elected, and we had a good year in 1992. But Prior to that time, when women were really a very, very small percentage of those in office, women introduced, in fact, it was the very first woman ever in Congress who introduced the very first piece of social legislation ever in history. It was a maternal child health bill. Literally, before she came to Congress, there had never, ever been a piece of social welfare legislation. But also, this very small minority of Congress that has been female over the years also introduced the GI Bill. You know, that was introduced by a woman. Not only the GI Bill, but the bill that set up the nationwide network of veterans hospitals. We have a woman to thank not only for the Equal Pay Act, but also for the Fair Labor Standards Act. You know, the one that said minimum wage, 40-hour week. That was introduced by a woman. The bill that created the Fair Employment Practices Commission, comprehensive child care and tax deductions for child care. You know those tax deductions that you get for child care? You can thank a woman Congress member for that. Federal aid to education. Where would we be without federal aid to education? That came from a woman member of Congress at a time when there were very few women there. The school lunch program. School lunch program, the Fair Credit Protection Act, federal funds for education of the disabled, federal aid to education, I said, and Title IX, the prohibition against discrimination in education and athletics. People think of it as just being athletics, but it's a prohibition against discrimination in educational opportunities for women and girls. And of course, there have been lots more recently as we've had more and more women in Congress. The numbers go up, like the Lilly Ledbetter Fair Pay Act, which was also introduced by two women, in fact. But it gives you a sense of some of the most important pieces of social legislation in the history of the country were introduced by a tiny minority of the members of Congress who were women, who then had to get the men to pass it. Imagine what it would be like if we really had half women. Now, equity and fairness and equal representation, you would think, would be good values for any society, certainly for any democratic society, but as you can see, even small numbers of women can have an important impact. But there's an impact beyond just legislation. Having women in leadership positions really does have an impact on society as a whole. For example, there was a recent study on the development of attitudes among young adults, and they found that increased female leadership in the form of public office holders had the effect of increasing the percentage of female adolescents who aspired to political leadership positions. And they looked area after area, and in each case where there were more female office holders, there was a difference in attitude among female adolescents about their own aspirations. It's something that you think logically would be the case because it's hard to be what you can't see, but we now have a study from just 2 years ago that confirms that that is the impact, and in fact, that may be one of the things that is limiting the representation of women in office, is because fewer young women are seeing those kinds of role models and not thinking of themselves as office holders. And in a really fascinating study that was just released in January of this year, it was an international study. They did surveyed 44,000 people in over 30 countries all over the world. The authors found that the percentage of women in the country's legislature was positively and significantly linked to the levels of equality attitudes held by the people who lived in that country, both women and men. These are some, I mean, I'm a math person. I love numbers, and my staff always says, don't do numbers. But I'm going to do some numbers because I am fascinated by this study. I am really fascinated. They found in this study that one additional percentage in female representation in the legislature, like going from 16% to 17%, just 1% difference, increases the odds 3.5% that any given person will have a moderate level of equality attitude as opposed to a low level of equality attitude. So 1% increase in representation of women, 3.5% increase from low to moderate equality attitude. Doesn't stop there. That same single percent increase adds a 6.4% increase in the odds of a person having an above average level of equality attitude compared to a low level. And lastly, for an additional 1%, that same 1% increase, there is an 8.8% increase in the odds that a given person will have a high level of equality attitudes as opposed to a low level. Think about it, a 1% increase in representation of women, and you've got 3.5% more moderate, 6.4% more above average, and 8.8% more high level of equality attitudes in that country. Is that stunning? And this is a big study. This isn't a random sample of 1,000 people. This is 44,000 people in 30 countries. And the conclusion that they reached was that the level of political representation has a significant effect on the attitudes of people in a society. And we could use a lot more equality attitudes in this society. And I'm excited to get a chance to talk about that because that's the first chance I've had to talk about that study, and I think it's stunning. I really do. 1%. How could just 1 more percent of women have such an impact on the attitudes of the entire population of a country? It really is stunning, and it should give us a lot to think about in terms of who we elect to public office, who we seek out to run for public office, and whether we, as women, feel qualified to run for office. Because I'll tell you, one of the things we run into when we try to recruit women to run for office, we often hear a woman who has done like all kinds of things will say, "Oh, me? Oh, no, well, I've only been, teaching for 18 years and a principal for 7 and headed the Parent-Teacher Association for 16 years before that. I could never run for the school board." I exaggerate only a little bit. But truly, let's face it, when men think about running for office, they say, "Oh, me, I'd make a fine member of Congress." And the women say, oh no, I'm not. Even when they have all kinds of qualifications. And one of the things that we've learned, and it's been reinforced by other organizations that do this work, is that women wait to be asked. I don't know why, I can't explain it, but they do. Most women, if you ask women who run for office the very first time they ran, well, what made you decide to run? And they say, well, Joe or Sarah or, so-and-so said that they thought I'd be good at that, and so it made me think about it, and I thought, well, maybe I would be. That's not to say that that's true of all women, but it's much more likely to be true of women, and we can wish that was different, or we can just start asking them to run. And I think it's easier to do that. So look around you. Next time there's an opening on your school board or your city council or your state legislature, look around you and see who in your community would do a great job, even though she hasn't thought of herself in that role. You can think of her in that role, and you could be the catalyst to making that 1% increase in your legislature. Before I get to questions about the equity imperative or anything else you want to ask about, I want to give a few shout outs to Kathy Rose Mackey for her organizing and to the really spectacular planning committee. If you're on the planning committee, would you raise your hand? Thank you. This is a rocking group of people. And also a special shout out to Kansas Now and Marla Patrick, the president of Kansas Now. They do such terrific work here to protect women's gains and also to make advances towards equality in Kansas. So thank you, Marla, for your leadership and for all the work of Kansas Now. And I want to ask you to do something for me, but really to do something for yourself. Take a step this week in Jana's footsteps. Volunteer at the Domestic Violence Shelter or the Rape Crisis Center. Donate to a group that supports equality. Join Kansas Now and help change the laws. Go to 1100 Torches and sign up to be part of Working for Change. That's the national campaign that was inspired by Jana's life. Because Jana's legacy can live on with your help. And soon you will be building a legacy of your own. You can make a difference in your community. And now that community organizer is a recognized career path, who knows where that might lead? Coretta Scott King, who was a member of the Now Board of Directors, spoke to our national conference the year that I graduated from law school, all fresh-faced and ready to take on the world. And I'm going to paraphrase just a little bit. She said, in that wonderful voice of hers, which I could not begin to imitate, but she said, "So let us continue to work together, because when we are together, there is a kind of strength that we get from each other. And when we are right, as we are, then we will certainly win our cause. Therefore, my sisters and brothers," that's the paraphrase, "let us walk together and don't get weary." Thank you for walking in the footsteps of Jana Mackey, and thank you for caring enough to be here. Thank you. I see people with microphones walking around. I would love to answer any questions you have. Everybody's in a big hurry to go home.
In the stunning study that you mentioned, that the increase would happen adding one woman.
1%.
1%. Did it make any difference if that woman was a supporter of increasing women's rights or not?
Well, I guess it would depend on the size of the legislature. I mean, to increase representation by 1% in the U.S. Congress, you would have to add 5 women, and chances are they would represent a multiplicity of views.
So it really didn't make any difference if they were
It didn't seem to. It was such a large study that and it covered so many different countries. I don't think they drilled down to actually look at the individual women. They were really trying to see whether the fact of having more women had an impact on on people's attitudes, and they found that the fact of having more women did have a significant and a large impact on people's attitudes. It was really quite amazing. I'm going to try to get more information from, it was a team at the University of North Carolina that did the study, so I'm looking forward to getting more information about it, see if they have some crosstabs we can look at. Zach? Oh, you have one over
First of all, thank you for coming. And I was wondering, when you were talking about the 16% in cases like firefighters, the military, I have a lot of friends who are military. I'm a firefighter. What should be the approach to, say, for instance, right now, the different requirements, physical requirements for women to complete to be a soldier versus men? Is that right? Is it patronizing? What should the approach be for something like that? Thank you.
Yeah. I mean, the approach for any job is that you don't want to hire anybody for a job that they're not qualified to do. At the same time, you don't want to have tests that unduly exclude people who, in fact, are qualified. And one of the things that we know happened in prior years when there was virtually non-existent representation of women in fire and police departments is, in fact, that there were tests that excluded women irrationally. In other words, that they were tests that did not reflect the job requirements. And so tests that reflect the actual requirements of the job are absolutely reasonable. And there's every expectation that a woman who wants to do that job, just like a man who wants to do that job, is going to pass those tests. And of course, we all know in our own lives quite a number of women who could pass a very rigorous physical test and quite a number of men who couldn't begin to. And there might be more men than women who could do it, but there's nothing that said, well, except for perhaps being either a sperm donor or wet nurse, maybe are the only two that you really to have that bona fide occupational qualification. If anybody thinks of another one, let me know. I'm looking to add to my BFOQ repertoire.
Hi, thanks for coming.
Thank you.
We're watching the stimulus money come down pretty quickly. It's hitting our town now. And I'd like to know what you've worked on to push the administration to do for women specifically, not just families, and what you're working on in Washington right now. Thank you.
Yeah, thank you. We've actually worked quite a lot on the stimulus program. We got involved last end of November, I guess it was around Thanksgiving. We started, there was a lot of conversation about the stimulus money and how much it was going to be and where it was going to go. And then in December, we started hearing that there was going to be, at the time, they were talking about $500 billion for shovel-ready jobs. And I had a pretty quick reaction to shovel-ready. I thought, I know the percentage of women in the construction industry, and it's not very high. My guess is that there are not going to be a lot of unemployed women who are going to be put to work by all of these jobs that are being created. And of course, women have a pretty high unemployment rate right now. It's not quite as high as men's, but it's still very high. And so we started talking to the friends in the administration and friends on the Hill, and trying to figure out what was going on, and it was moving pretty fast. And so we pulled together a group of women's organizations that, not just women's organizations, but organizations that represented a lot of women, like the nurses and the teachers and the social workers, the librarians, the YWCA, which has one of the largest providers of child care in the country. I mean, we just brought a very diverse, along with some of the women's legal organizations, and asked for a meeting with the transition team, which was agreed to instantly. I mean, there was no hesitation. They said, "Oh, great idea. We'd love to meet with you. Pull the people together, and we'll set it up." And so Ellie Smeal and I pulled all of these folks together, and we met with the transition team. But before we did that, we put a plan together. We met. We talked among ourselves. We said, "Okay, this cannot be a laundry list of all the things that have been underfunded that this big pot of money is now going to fund. Because they were very clear that this was going to be stimulus only. It had to be 6 months to 2 years. It had to be time limited. It had to be specific project driven. There had to be results at the end. It had to be sustainable. I mean, they've been very clear in the administration what the requirements were. And we said, okay, we can do that because we know that as much as we need to rebuild the country's physical infrastructure with these shovel-ready jobs, no question about that, but we've got a crumbling human infrastructure. We've got to rebuild that as well. And we can't build schools over here while teachers are being laid off over here. And social workers, the social workers were telling us that basically there were no jobs at all for new graduate social workers. I mean, literally no jobs at all. The librarians said 70% of the people who use the public library say they use it to look for a job. Yet the libraries are being closed and the librarians were being laid off. And when you think about teacher layoffs, think about what it takes to train and attract a teacher to the profession. You lay off a bunch of those teachers and they move into another profession and get themselves established doing something else. When the economy recovers, are you going to be able to get them back? No. This is dumb, right? Why would you let all of these teachers go knowing what a hard time you're going to have getting them back? And so we put together a set of proposals that did one of the two things, either stimulate the economy, and we had a set of proposals to do that were very specific and time limited, or proposals that helped people who were suffering from the downturn, because it was the Recovery and Reinvestment Act. It was designed not just to stimulate the economy, but also to help the people who were suffering and get them over that hump as well. And so we had a meeting with some very, very high-level members of the transition team, high-level economic advisors, got a really good response. I think we were surprised at who was in the room. We were like, oh, we're going to meet with a bunch of assistants. And we didn't. We really met with very high-level staff and got a tremendously good response from them. But we didn't stop there. We met with the top economic advisors to Nancy Pelosi, the Speaker of the House, and the Senate Majority Leader, Harry Reid. We met with his top economic advisors as well, and his Chief of Staff and Nancy Pelosi's Chief of Staff, and made our case to them as well, because we wanted to make sure that both ends of the stimulus plan writing had input from this coalition of women's organizations that had specific proposals. And indeed, we have seen our fine hand in the final product. It's hard to tell in some areas where they did and didn't use our suggestions, but quite a number of very specific things that we suggested ended up in the final plan with actual dollar amounts attached to it. So we felt that it really had been a greatly successful effort, and perhaps the best of all was there was an analysis that was put out by the White House of the stimulus plan in, I guess it was in early February. Christina Romer and Jared Bernstein did it, two economists. She's the head of the, I think, Council of Economic Advisors. He's the economic advisor to the Vice President. There was a gender impact study in it. I'd never seen that before, but we had raised it so many times, and we said, how many of these jobs are going to go to women? Are women going to be fairly treated in this? That they did a gender impact study. According to their study, about 42% of the total jobs generated by the stimulus package were likely to go to women, and about 58% to men. It's not a very scientific thing, but it was the best estimate they could do. And that was not far afield from the proportion that had lost jobs in the last, at least in the last year or so. It was much more even before that, but in the last year it has been somewhat disproportionately men's jobs lost. The only bad thing is that the the 42% that were likely to go to women tended to be in the lower paying industries, tended to be in retail and service industries, whereas the jobs that were disproportionately male were in much higher paying areas like engineering and construction. But I guess that'll probably mirror the existing wage gap.
After living in Kansas for over 50 years, I finally made it over to Amelia Earhart's birthplace museum in Atchison, Kansas with my granddaughter, Amelia. And I was thinking after that Homestead Museum is run by women pilots, but I don't think any of them work for major airlines or ever have. When will women show up in cockpits of major airlines in greater numbers?
Yeah, I see it, but not too often. I actually poke my head in the cockpit fairly regularly, and partly that's because my first major in college was professional aviation, because I wanted to be a Delta pilot. What can I say? I grew up in North Louisiana, and the headquarters of Delta Airlines was Monroe, Louisiana. And I was going to Louisiana Tech University, which was 30 miles down the road from Monroe, and all of our flight instructors were Delta pilots. And I was the only woman in the curriculum. I was the only woman. I was 16 years old, and I was the only woman in the curriculum. And finally, the cost just got too high. The flight hours were you had to pay by the hour for your flight time, and it was really expensive. And then one of the guys said, "What do you mean you pay for flight time?" Like, what? You don't pay for flight time? No, we don't pay. Do you pay for flight time? No, I don't. What do you mean you pay for flight time? It was a source of real consternation for all of us. Then it turned out that they didn't realize that I wasn't in ROTC, which all of them were. Because when you're in ROTC, they pay for, it was Air Force ROTC, they pay your tuition, they pay your flight time, and they got a monthly allowance that was enough to have an off-campus apartment and utilities. It was about $325 a month, and my apartment with utilities furnished was $100 a month. So that was a lot of money in 1970. We are sort of talking ancient history here. But 1970, that was a lot of money. And so I said, wow, what a deal, I'm going to go sign up. And I went to sign up, and they said, we don't take women pilots. They did later. In fact, 1972, the Air Force started taking women pilots, but I was long into another major 2 years later. But it has been an area where there have not been a lot of women, except in the military. The military has, according to reports I get anyway, has been very accepting of women pilots. At least the command has been very accepting. Sometimes their co-workers have been less so. But I think that particularly with Iraq and Afghanistan and the number of women who are getting serious flight training and thousands of flight hours, I think we'll probably see some of them going into airlines. But it's an interesting area. It was one of my first encounters with somebody saying, you can't, you're a girl, you can't do that.
First off, I'd just like to say that not only is it very empowering to see women in high places, but it's very empowering to see short women in high places. So I would just like to thank you for that. Well, I really appreciated what you said about looking at universal health care and making sure that people are aware that that default patient is male. However, I also think it's very important that we are aware that that default patient not only is male, but is white, middle-class, heterosexual. So how can we, which, I mean, and in my opinion is a feminist issue, so how can we, when we're lobbying or, or doing activist work with this situation, how can we go about making sure that people are taking an enumerated approach to it.
Well, I think that what we may have to do, frankly, is identify specific things. I know nobody ever wants to be specific when they're doing legislation, but frankly, I think if you don't say mammograms are covered, you risk mammograms not being covered until they absolutely have to cover them, like when you're 65 or something, when it's too late. And I mean, there are standards of care that need to be followed, and especially in populations that are not white and straight. You have different issues. You have different health care issues. You have different needs. You have different tests that need to be run, that you need to be guaranteed that your child can have a sickle cell anemia test for evaluation and treatment purposes. And if it's not guaranteed, then how do you make sure that it happens, especially if your patient is not somebody who's really in a position to advocate strongly for themselves? So it's a very good point, and I know that there are people in the administration who care very deeply about this, but there also are tremendous forces arrayed against them and against including anything that they can manage to get away with excluding. And so that's going to be a fight for all of us, and we have to make sure that they don't do to this plan what they did to Hillary Clinton, and that they don't pull a Harry and Louise that scares people and frankly misrepresents to people what the plan is. And it's going to be up to us to talk to our neighbors, because the millions, the tens of millions, will be spent by the insurance companies to make sure that they get to maintain their role in the middle, where they get to just scarf up a little piece of the money out of the center, and it comes out of our health care. And that's not to say, I know very wonderful people who work at insurance companies, and they need to go work for car insurance companies and not for health insurance companies.
We're going to have 2 more questions.
You mentioned that you are a mom of 8th and 10th grade girls, and I have my 8th grade daughter here with me tonight. So I'd like to know what message you would send to the very young women in the next generation.
Well, it's sort of mixed. I think about it a lot when I talk to my daughters, because there's part of me that wants to say what the last generation said, which was, you can do anything. You can do anything, you can be anything you want. And hoping against hope that by the time they get old enough to want to do that, it will actually be true. And I think I've sort of defaulted to that position. But the other thing I tell them is, in this world, you have to stand up for what you want. You have to tell people what you need, because they can't make it up or imagine it. And you have to stick up for what you think is right, even if it means sticking up for yourself. Because a lot of girls, girls get socialized by society, beyond what we tell them as parents, and sort of like it's okay to take up for somebody else, but it's not okay to ask for something for yourself. And that's something that we have to socialize back into girls, that it's great to stand up for other people. That's a really important quality, and we want you to do that, but we also want you to stand up for you when it's your turn to stand up. And don't wait for somebody else to do it. You can speak up for yourself, and to look to figure out what you want and really work for it, and not take no for an answer. And I think so far my daughters seem to be doing that, especially the not taking no for an answer part. I may have done my job too well. They have picket signs, for when they... Popcorn now.
Hi, thank you for coming. This has been a really excellent evening. I just wanted to follow up on what you said, something at the beginning about how a lot of people think that strides have been made, that there's not a lot of progress yet to be made out there. And I often feel that young women think that things are kind of done. Like, they can get into law school, they can get into medical school, they can do what they want. But what's it going to take for us to get to that next level as a country where we're talking about things like affordable, quality child care, paid parental leave, those next level of policy advances that it's going to take to truly get to an equal gender balance in the country?
Well, I hate to break this to you, but I've been active in now since 1973, and we were working on quality, affordable child care in 1973, and we were also working on paid parental leave. We ended up, it took 20 years from that point for us to finally get the Family and Medical Leave Act, which had unpaid leave, but it wasn't because we didn't try to get paid leave even then. But it's interestingly, I look back at just the other day. It was the 10 initial goals when NOW was founded in 1966, and in 1967 we did a brochure of the 10 top things that we wanted. Child care tax credit was one of them. We actually got that, and having child care be available not as a poverty program, but as something that is available, and we didn't call it child care, we called it early childhood development, even in 1967. Early childhood development would be available not as a poverty program, but to all children, not as an assistance to their parents, but as the right of the child to be safe and educated and in a quality environment, and that it would be available to everyone on the same basis as streets and parks and highways. Highways are there even for people who don't own cars. Parks are there and paid for by the public, even for people who don't have dogs or don't go to the park. Early childhood development should be available to everyone, whether or not they have children. It's not relevant. It was, I think, a very forward-looking position for the organization, as were many of the things that we've worked on for a long time. Those are on the plate. Getting them in front of people is the biggest challenge. We have a paid leave bill that was just put in Congress quite recently. Carolyn Maloney, who is a real champion of women from New York State, introduced paid family leave for federal employees. It's not a lot. It's 4 weeks of paid leave for birth or adoption of a child, but it's a start. The U.S. stands almost alone in the world in having no paid maternity leave for a female employee who is giving birth. None. There are 3 other countries in the entire world that guarantee no paid maternity leave. And we're in great company. Lesotho, Swaziland, Papua New Guinea, and the United States of America. That's it. Every other country in the world, you name it, they all guarantee some amount of paid maternity leave. They recognize that these days you're just not likely to drop the baby in the field. Think about it. No leave, 0 leave. It really is a little crazy. And a lot of women can't take the unpaid leave. They take 2 or 3 days of unpaid leave and they're right back at work well before they should be, truthfully. And that's just inhumane. And so we're starting. We've tried for the longest time to do the big thing, paid leave for everybody. And so we decided to start trying to bite it off in chunks and start with federal employees, with the argument that the federal government's got to be competitive, and that only about 12% of private employers give paid leave. One of them is my organization. But it's mostly the biggest groups. It's the Shell Oil, and it's the largest employers that give paid leave, and that's who the federal government's competing against for top talent. And so that's our case, is if you want the federal government to be competitive with business and industry for top talent, you have to begin to think about matching their benefits package. And that's one really key area where the federal government doesn't match the benefits package of the largest employer. So we're taking a different approach to paid leave this time, and we think it's a start, because once we have it for federal employees, then it's going to be a lot easier to take the next step. Once the legislators figure, well, we're paying for it, they should pay for it too. But we're constantly looking for new and creative ways to bring those agendas, those issues that have been on our agenda literally for decades, to repackage them, to put them in a new light, and to take a different approach to finally getting them passed, because we are nothing if not persistent. Is that all? Oh, thank you. Thank you.
That's scary too. Thank you.
Thank you so much.
My pleasure.
Please join me again in thanking Kim Gandy. Before we close for the evening, some very heartfelt thank yous. I want to thank the Dole Institute staff, Bill Lacey, Barbara Ballard, Corey Ast, Jonathan Earl, and the other wonderful Dole Institute staff that helped us create this wonderful program this evening. I also want to thank the School of Law, who has been a significant contributor to this program. I also ask you to look at the back of your booklet, and if you all can read that small type, congratulations. It shows you what a wonderful collaborative process this is. Well, the small type is not an effort to not acknowledge people. It means we had so many partners and contributors in this project, it was hard to fit them all on one page. And I want to thank them all this evening, because we would not be able to have pulled this program together without everybody's support. Thank you. Before we leave, I want to challenge you and follow in what Kim was saying, to encourage you to now take the torch. Challenge the status quo, as Dr. Taylor always said, and follow Jana's example by taking action and being a change agent. As you go out, you will see there are tables in the back that have a lot of information about many, many ways to get involved. Pick up a pamphlet, take a minute to look, and get involved. And thank you for coming. I'm so glad you were here. We needed you.
It was great fun.
And if you're thirsty, there's plenty
I have
of
lots
water.
of